Good morning. In this video, we are going to try to finish the slides that are included in the your final semester test. And in this video, we will focus on the disease that might affect the valves, which we call valvular disease. The first, we will study every valve, like the mitral valve, the tricuspid valve, the aortic valve, and the pulmonary valve. And we will be studying both the condition when the valve is narrow, which we call stenosis. So we say a stenotic valve, and the condition when the valve is not closing perfectly, which we call incompetent valve, or a case of incompetence of the valve. We will start by mitral stenosis. In mitral stenosis, the main defect is that the mitral valve is narrow. If you look at the left side of the diagram, you can see a normal valve, a normal heart, and you can see that the mitral valve is normal. This is the normal width of the mitral valve. But when we look to the right, and this is the cross section, when we see a top view of the mitral valve, this is the normal opening. But when we have a narrowed mitral valve, and this is again the top view of the mitral valve, this is it's clear that the opening of the mitral valve is much smaller than the opening in the normal condition. This is what we call mitral stenosis. So if we look at the longitudinal section of the heart, we will see the difference in of course, this is a very narrow mitral valve, an advanced condition of mitral stenosis. And you can see here the cusps. This is the first one, this is the second one, and this is the third one. So what is the main defect in mitral stenosis? When the blood flows from the left atrium to the left ventricle, and this of course happens during diastole because the left ventricle has to be relaxed to receive the blood, it will pass through a narrow valve. In every condition, in every valvular disease, we will see how this is reflected on auscultation. When you listen to the heart sounds, you are supposed to hear two heart sounds. You are supposed to hear the first heart sound and then the second heart sound. And you are not supposed to hear anything in between. And then another first heart sound and another second heart sound. We said before that the first heart sound is due to closure of the semi-lunar valves, due to closure of the atrioventricular valves, the mitral valve, and the tricuspid valve at the beginning of ventricular contraction. So here, when we hear the S1, this means that both the mitral valve and the tricuspid valve started their closure at the beginning of left ventricular and right ventricular systole. So this period of time will be the systole. And then the second heart sound occurs due to closure of the semi-lunar valves, due to closure of the atrial valve or aortic valve, and due to closure of the pulmonary valve. So again, it is due to closure of the aortic valve and due to closure of the pulmonary valve, which are the two semi-lunar valves. And as you know, these two valves close at the beginning of diastole. So this period of time after the second heart sound is diastole. And as we said before, diastole should be longer than systole because it is the time allowed for the ventricles to relax and to fill with blood. So if there is a problem during passage of blood from the left atrium to the left ventricle because of a narrowing in the mitral valve, so this means that there will be an abnormal flow of blood from the left atrium to the left ventricle during diastole, during relaxation of the left ventricle. Why is there an abnormal flow? There is an abnormal flow because the blood is passing through a narrow valve. And therefore, the flow of blood will be described as turbulent flow. What is turbulent flow? This is an abnormal type of flow, of liquid flow in general, when liquids pass through passages that are too tight for them. So the normal flow, how then do we call the normal flow? When the left atrium and the left ventricle and the valve in between are normal in dimensions, and especially this valve, which is the mitral valve, there is what we call laminar flow. Laminar flow. What is laminar flow? Laminar flow is a, a very organized flow where the layers of liquid are parallel to each other with no interference between the layers. Say this is layer 1, layer 2, layer 3. They are traveling smoothly over each other without friction, and the maximum velocity, the maximum velocity is that of the layer in the middle. Suppose this is a cylindrical, for example, vessel in which the fluid is passing. So this is what we call laminar flow or streamline flow. This is laminar flow of blood or of whatever liquid, and you might also call it streamline flow. This is a very regular flow where the layers of blood flow smoothly one over the other when there is minimal friction between the two. It's very organized, it is very regular, and Vmax, or the maximum velocity, is for the layer in the center. Why do we have this laminar flow? Because the diameter of the vessel in which the vessel diameter, say for example, the blood vessel diameter, is comfortable for the volume of liquid that is passing. This occurs when we have a normal valve. So when you have a normal valve, there is, and this applies, by the way, to all the orifices, to all the openings, to all the valves, to all the vessels that carry liquids. So when the diameter is adequate for the volume of liquid that is passing, we will have a laminar flow. What's the importance of having a laminar flow? The importance of having a laminar flow is that the laminar flow of blood first of all, we have to know that a laminar flow is obtained when the blood passes through a normal atrioventricular valve, through a normal atrioventricular valve. And when we have a laminar flow, there is no abnormal sound that is heard. There is no abnormal sound that is heard or that is superimposed on the first heart sound and on the second heart sound. The abnormal sound that is superimposed on S1 and S2 is called a murmur. So what is a murmur? If this is S1 and this is S2, when the tracing that records the two sounds, then the murmur in case of mitral stenosis will be during diastole. It will be after S2. So after having heard the second heart sound, you will hear another sound here in the middle of diastole, and before the appearance of the next S1 of the next cardiac cycle. This sound is a murmur. So how can we define a murmur? A murmur is an abnormal sound that you hear in between S1 and S2 or in between S2 and S1, meaning during systole or during diastole. And this abnormal sound does not muffle, does not override S1 and S2. So it is an abnormal sound that is superimposed, meaning added onto S1 and S2. So what is a murmur? A murmur is an abnormal sound that you hear by the stethoscope and that is superimposed on S1 and S2. This is the general definition for any murmur due to abnormal flow through any of the four valves when they are too tight or when they are too wide. But this is not enough to define the abnormality. This is not enough to define the murmur. You also have to say when the murmur occurs. So in case of mitral stenosis, we say that it is a diastolic murmur. Diastolic murmur means what? Diastolic murmur means during ventricular diastole. And in such a case, because we are on the left side, it's the mitral valve, then it is during left ventricular diastole. So what does it mean other than during left ventricular diastole? It means that it is a murmur that you hear between S2 and S1. Why do we start by S2? Because when we say between S2 and S1, on the audiogram that represents the tracing that represents the heart sounds, we mean that this occurs during diastole. What remains to define mitral stenosis is to say where the murmur is best heard, where you should put your stethoscope to best hear the sound. Of course, on the mitral area, since the murmur is originating from the mitral valve, then the mitral area is the best place to hear this sound. Of course, you can hear it on the 5 auscultatory areas that we mentioned before. But when we say mitral area, when we say put your stethoscope on the mitral area, this is to best hear the murmur. Of course, there are hemodynamic consequences that are resulting from mitral stenosis. It's not only about a narrow mitral valve, but there are consequences or consequences. These consequences are an advanced level, but for those who are interested, I will be saying them very rapidly. So if this is a diagram that represents the chambers of the heart, so we are focusing here on the left atrium and the left ventricle, and we have a narrow opening here, which is a stenotic mitral valve, which is a stenotic mitral valve. What does this mean? This means that when the left atrium tries to pass the blood from its chamber to the left ventricle during diastole, the blood finds great resistance to pass. So a stenotic mitral valve means resistance to pass. So gradually, the left atrium will enlarge. First of all, the pressure inside the left atrium will increase. And then later on, the muscles of the left atrium will yield, will be submissive. They can no more resist this increase in pressure. But I'll not be talking about that final stage when they yield. I'll be talking about the condition when the pressure in the left atrium increases. This leads to what? This leads to we know that there are the pulmonary veins that carry the oxygenated blood from the lungs. So there will also be increased pressure in the pulmonary veins. Not only increased pressure in the pulmonary veins, but in the later stages, there will be a retrograde flow of blood. The blood will backflow, the surplus blood that the left atrium cannot afford. The left atrium will say to the pulmonary veins, stop sending blood to me. I can no more afford this. I can no more carry the blood to the left ventricle. So gradually in severe long-standing cases, there will be backflow to the lungs. At the beginning, it's minimal backflow, but the lungs will become congested with blood, meaning that there will be a lot of blood in the capillary circulation of the lungs. And of course, the patient will suffer from dyspnea. In very late stages, this will be reflected on the right atrium and then on the right ventricle, which will finally fail, meaning that it will dilate and no more be able to send blood to the lungs. On the other hand, because there is less blood that passes from the left atrium to the left ventricle sends less blood to the aorta. Sends less blood to the aorta simply means sends less blood to the body. And if the whole body receives less blood, this means what? It receives less oxygen, it produces less energy, and that's why the patient is always fatigued, dizzy, and all these cardiac symptoms that the patients suffer from. So the major symptoms here are dyspnea in long-standing conditions, but first of all, fatigue. So fatigue comes number one, fatigue and dizziness, lightheadedness come first place, and then second place in late conditions, we have dyspnea. In mitral regurgitation, the main problem is that the mitral valve does not close perfectly. The mitral valve does not close perfectly. When does the mitral valve need to close perfectly? At the beginning of systole. At the beginning of systole. Why? Because when the left ventricle starts to contract and the pressure inside the left ventricle increases, the mitral valve should close completely. So normally at the beginning of left ventricular systole, when the left ventricle starts to send oxygenated blood into the aorta, see that the mitral valve should be completely closed. But what happens in mitral regurgitation, whether it is an acute mitral regurgitation due to, for example, a sudden severe inflammation that perforated the valve, or in chronic mitral regurgitation due to an autoimmune disease like rheumatic fever, in both cases, whether it is acute or chronic, when the left ventricle starts contracting and sending oxygenated blood into the aorta, meanwhile, the mitral valve is not perfectly closed and there is backflow of blood into the left atrium. In such a case, of course, this blood is normal. This is the normal direction during systole from the left ventricle to the aorta. But that arrow represents abnormal flow of blood. So this abnormal flow of blood results in a murmur, in an abnormal sound. When will this abnormal sound be heard? During contraction of the left ventricle. And that's why mitral regurgitation is associated with a systolic murmur. It's a systolic murmur that lasts during the whole systole. So there is a murmur, and that murmur is a systolic murmur that occupies most of the systole. So if this is the tracing of the first heart sound, and this is the tracing of the second heart sound, and then the next first heart sound, then this is systole and this is diastole. Where are we going to hear the abnormal sound of mitral regurgitation? We will hear it here in between S1 and S2, and this is the systolic murmur of mitral regurgitation. Again, where are we going to find it? Over the mitral area. So this mitral area, which is one of the auscultatory areas, it is in the fifth intercostal space, mid-clavicular line to the left. This is where you can best hear a systolic murmur. Of course, as you can see, if it is an acute mitral regurgitation or backflow, as I said, in mitral stenosis, there will also be an increased pressure. So the consequences in mitral stenosis and in mitral regurgitation have common things, like, for example, elevated pressure in the left atrium. In chronic cases, because the condition occurs slowly, the backflow occurs over a long period of time, so it will result in a gradual dilatation of the left atrium rather than an elevation of pressure. But all the rest is similar, because when there is more blood than usual in the left atrium, then there will be backflow across the pulmonary veins and then backflow to the lungs. We will have congested lungs and dyspnea, and then on the long run, this backflow will affect the right atrium and the right ventricle. In case of tricuspid stenosis, we will have narrowing of the tricuspid valve secondary to rheumatic fever, secondary to an autoimmune disease, and this stenosis will occur on the right side. So this is the normal tricuspid valve. This is a normal tricuspid valve that lies between the right ventricle, the right atrium and the right ventricle, but this is a stenotic tricuspid valve. So similarly, blood will pass with difficulty from the right atrium to the right ventricle during what? During right ventricular relaxation, during right ventricular diastole. Because blood passes through a narrow valve, then we will have turbulent non-laminar flow. And because we have a turbulent non-laminar flow, then we will have a murmur. And because the murmur, which is an abnormal sound superimposed on S1 and S2, occurs during diastole, then it is a diastolic murmur. But this time, where can we best hear the diastolic murmur? We can best hear it over the tricuspid area, fifth intercostal space on the left sternal edge. So once you have understood the main principles of the hemodynamic changes in the valvular diseases, you can deduce them on your own. What is a diastolic murmur? It is a murmur that lies between S2 and the following S1. This is very similar to the diastolic murmur in case of mitral stenosis. The only difference between the two is the site where you will best hear the murmur. Again, when we studied mitral stenosis, we said that the murmur in mitral stenosis is a diastolic murmur, which means that it lies between S2 and the following S1. Similarly, the murmur in tricuspid stenosis is diastolic. So how can I differentiate between the two upon auscultation? Since both occur after S2 and before the next S1, it's only through their location where you can best hear them. So in case of mitral stenosis, you can best hear it at the mitral area. you can best hear the murmur at the apex, whereas in tricuspid stenosis, you can best hear it in the or over the tricuspid area. In tricuspid incompetence, similarly to mitral incompetence, we have regurgitation of blood or backflow of blood. And of course, as the hemodynamics imply, this backflow occurs during right, because we are on the right side, right ventricular systole. Why? Because here you have the normal valve. Look here, this is the right ventricle, and the right ventricle is pumping blood into the pulmonary artery. This means that the right ventricle is in systole, and that's why the tricuspid valve should be perfectly closed. The tricuspid valve should be perfectly closed, and that's why we say that this is the normal condition. Why is the right ventricle so narrow? Because it's contracting, so it's pressurizing the blood inside and the volume is decreasing. But to the right, you have the abnormal condition. You have the condition when the right ventricle is in systole, when the right ventricle is contracting and sending blood normally through the pulmonary artery, but the tricuspid valve has a major problem, that it's leaking blood backward. There is a backflow of blood into the right atrium and, of course, into the superior vena cava, because if blood leaks into the right atrium, then it will also leak through the superior, or regurgitate and backflow through the superior vena cava and the inferior vena cava. So again, this is the abnormal condition. The right ventricle is contracting. The right ventricle is in systole. Blood passes normally through the pulmonary artery, but there is backflow into the right atrium, because this is the right atrium and this is the incompetent, too wide or imperfectly closed valve. So at the beginning, it will only leak into the right atrium and results in a dilated right atrium, but afterward it will also leak into the superior vena cava and into the and when I say leak here, I mean maybe leak is not the best verb. I mean backflow, regurgitate into the superior vena cava and into the inferior vena cava. Of course, if it leaks into the inferior vena cava, the main problem for the patient would be edema or swelling of the lower limbs, lower limb edema, because the veins are congested with blood. But there is another problem. If the right ventricle regurgitates blood, or if there is regurgitation of blood into the right atrium because of an imperfectly closed tricuspid valve, then less blood will flow into the pulmonary artery, which means less blood will be oxygenated into the lungs, and which means that the patient will definitely suffer from dyspnea because of diminished oxygen levels in blood. When does tricuspid incompetence occur? You might be asking yourself when it occurs. It occurs during right ventricular systole. So it occurs during systole. So again, if this is the tracing, S1 and then S2 and then another S1. So if it occurs during diastole, then it occurs here. It's very similar to what? It's very similar to I'm sorry. This occurs during right ventricular systole, and if it occurs during right ventricular systole, so it occurs between S1 and S2. Tricuspid incompetence occurs during right ventricular systole and during right ventricular contraction. So it occurs between S1 and S2. So here you're going to see the abnormal murmur between S1 and S2 on the tracing. But what's the difference between mitral incompetence and tricuspid cuspid incompetence. Both result in a systolic murmur. Both occur during contraction of the ventricles when the corresponding valve is incompetent and when there is backflow of some blood from the ventricle into the atria during systole. So they are both heard between S1 and S2, and they are both systolic murmurs. The only difference, again, is the site or the location where you will best hear them. Since here we are talking about the tricuspid valve, so they will be best heard over the tricuspid area. In aortic stenosis, we have a narrowing of the aortic valve. When does stenosis means narrowing? So when it is stenotic, this means that it is narrow and smaller than normal. When it is incompetent, this means that it does not close perfectly and it allows regurgitation. Here, we are studying aortic stenosis, meaning that the aortic valve is narrow, is smaller, the diameter is smaller. When will this affect hemodynamics? When I say hemodynamics, I mean the flow of blood, whether inside the heart or from the heart to the outside vessels. Hemo means blood, and dynamics means kinetic or movement. So it will be seen when the left ventricle contracts, because during left ventricular systole or during left ventricular contraction, the blood will pass from the left ventricle into the aorta through a narrow valve. So we will be hearing a systolic murmur, and that systolic murmur during systole of the left ventricle will be best heard, of course, on the aortic area because it is originating from the aortic valve. So again, we have S1, and then we have S2, and then a longer period, which is diastole, and then S1, and then S2, and so on. So S2 should be a bit shorter. So it is a systolic murmur, meaning that it occurs between S1 and S2. How can I differentiate it from other systolic murmurs? Just I'll not be differentiating it adequately from the audiogram. Of course, they have the different systolic murmurs because of different valve diseases are all between S1 and S2. They have minimal differences in the tracings, but you cannot best differentiate them until you auscultate. And the best way to differentiate systolic murmurs is by their location. So here you can best hear the murmur of the aortic valve stenosis on the aortic area. I mean the second intercostal space just to the right of the sternum. Of course, if you have aortic stenosis, then the left ventricle will do much more effort to pump the blood into the aorta, and the aorta will receive less blood. So the thicker wall, here we have a thicker wall, and the left ventricle will undergo what we call left ventricular hypertrophy. Hyper means increased, and trophic means nutrition. So hypertrophy means that the left ventricular muscles will try to accumulate more glycogen in order to produce more energy to contract. So the left ventricle, the muscles, the different muscles will increase in size. They'll not increase in number. Muscles do not increase in number. They do not divide, but they accumulate more stuff to get more energy. So they increase in size. Is it good? It's good temporarily because it allows the left ventricle to produce more and more energy to overcome the resistance. But if you do an echocardiogram, ultrasound to the patient and find that there is left ventricular hypertrophy, you are anxious because you must be anxious and you must follow up because left ventricular hypertrophy will be followed later on the long run by left ventricular failure when the myocardium of the heart, the muscles can no more afford getting more and more energy to overcome the resistance. And when there is left ventricular failure, there is a drop in the blood pressure and worsening of the condition. At the same time, as we said, the aorta is receiving less blood, a smaller blood volume. And when it receives less blood, this means that there will be less oxygen and less energy available to the tissues. And the main symptom in aortic stenosis is fatigue. The murmur, as I said, is a systolic murmur. In aortic incompetence, this is a serious condition when you have incompetence of the aortic valve. This is the aortic valve. And incompetence means that, first of all, you have imperfect closure. So the imperfect closure might be because the cusps cannot close or because the valves are damaged, so they become far away from each other. Anyways, there is the ultimate result in aortic incompetence is imperfect closure. When do we need the aortic valve to be perfectly closed? During left ventricular diastole. So when there is imperfect closure of the aortic valve during left ventricular diastole, this means that every time the left ventricle relaxes, and every time the valve should have been closed before relaxation, we find that it's not closed and that there is regurgitation, diastolic regurgitation through the aortic valve. So you will hear what? You will hear this is S1 and then S2 and then S1 again and then S2. Of course, the longer interval lying is diastole, and it lies between S2 as usual. Diastole is always between S2 and the next S1. Then this imperfect closure will result in a murmur in the middle of diastole, and that murmur represents the backflow of blood from the left atrium to the left ventricle during diastole type. We have seen other diastolic murmurs between S2 and S1 resulting from, for example, other valve defects, other valve diseases when we had during diastole incompetence and regurgitation of blood, or the blood passes through a narrow valve. So in such a case, how we can differentiate between the two? We can differentiate by the site. Here, the regurgitation this diastolic murmur can be best heard again over the aortic area. Notice that we have heard aortic stenosis over the aortic area, and we have heard the aortic incompetence over the aortic area. So how can we differentiate between the two? The murmur of aortic stenosis is best heard during systole between S1 and S2, whereas the murmur of aortic incompetence is heard between S2 and S1. So here the differentiation would be a chronological according to the time. So over the aortic area, when you auscultate the aortic area, if you hear a murmur, then this murmur must have originated in the aortic valve, because this is where you best heard the murmur. So you will have to ask yourself, is it a murmur of aortic stenosis, or is it a murmur of aortic incompetence or aortic regurgitation? If it is a murmur of aortic stenosis, then it occurs during left ventricular systole, so it will be between S1 and the next S2. But if it is due to regurgitation, so it will be a diastolic murmur, and therefore it will be between S2 and the next S1. And the same applies to the tricuspid valve. For example, if you hear a murmur over, I'm trying to wrap up. So if you hear a murmur over the tricuspid area, best heard over the tricuspid area. I'm talking about where it is best heard, then it must be originating from the tricuspid valve. So it is either tricuspid stenosis or tricuspid incompetence and regurgitation. So if it occurs because of tricuspid stenosis, then it will be here a diastolic murmur. Notice that the semilunar valves and the atrioventricular valves are opposite to each other here because the diastolic murmur for the aorta was during incompetence and not during stenosis. If it is tricuspid incompetence, then it will be a systolic murmur. So again, if you hear the murmur, you hear it best on the tricuspid area, and you want to know whether it is stenosis or incompetence of the tricuspid valve, of course, because if it is best heard on the tricuspid area, then it is the tricuspid valve that is injured or harmed. Then diastolic means what? Again, diastolic means if this is S1, S2, the next S1, then diastolic means between S2 and the next S1. If it is systolic, then it is between S1 and S2. Of course, the same applies to the mitral valve, and I'll not be repeating this, but you can do a summary. You can make like a summary for the valvular diseases and make sure you understand the hemodynamics. The last valvular lesions are those of pulmonary valves. So if of the pulmonary valve, uh, I'll be going rapidly over them. If you have stenosis, as usual, then you have a narrow pulmonary valve. Then the right ventricle, during pumping of blood through the pulmonary arteries to the lungs, will find resistance. So at first, the right ventricle will be hypertrophied because of the resistance. We have right ventricular hypertrophy, and of course, it will be later on followed by right ventricular failure. Less blood will be passing to the lungs to be oxygenated, then less oxygen and less energy will be derived from, less oxygen will be obtained from the lungs, less oxygen will reach the tissues, and therefore less energy, and the murmur is heard during systole. So you will hear a systolic murmur between S1 and S2 over the pulmonary area. In case of pulmonary incompetence, it's exactly the opposite of pulmonary stenosis and similar to aortic incompetence, meaning that every time the right ventricle relaxes, you will find that this is the pulmonary artery. So when the right ventricle relaxes, when the right ventricle is in diastole, the pulmonary valve, this one, should be completely or perfectly closed, but it is not. So there is backflow during diastole. So the abnormal sound will be a diastolic sound, but where? Over the pulmonary area. Having said this, I would have finished the intended slides to be explained, and you will be receiving a worksheet to apply this information onto clinical conditions. Thank you.